Now, what kind of rules? There are some rules of the Affordable Care Act that are going to apply even if you do protect your grandfathered plan status. Those are, you have to allow for dependents to remain eligible and covered as a dependent until they turn age 26. Ladies and gentlemen, it doesn't matter whether they're married, it doesn't matter whether they don't live with you, they're eligible dependents until they turn 26. And that too takes effect October 1st, on renewals on or after October 1st of this year. Now, you're not obligated to cover them as dependents, but the insurance company has to allow you to. And I would suggest that a lot of my clients typically secure coverage on their younger adult children anyhow. So I don't really see that as much of a problem, but it will apply even if you protect your grandfather plan status. Summary benefit and coverage regulations, again, not a real big deal. Automatic enrollment for employers with more than 200 employees. This probably won't affect most of the businesses in this room. Other ACA rules are prohibitions on lifetime or annual limits. Again, I don't have any bone to pick with that. Pre-existing condition exclusions. I don't have as much of a problem with pre-existing condition exclusions now as I used to, but it is still a little bit of a problem, and that'll be going away. And rescissions. I've only had 2 of these arise across my desk in the last 25 years. One of them I was able to get reversed, and the other one was there was a good reason for it. Yes?
What is a rescission status?
That means that if I buy a policy today and I pay the premium for 6 months, and then I have a claim for cancer, and I had been having cancer for years, and I bought the policy after I had cancer, and I was not honest in the application process, the insurance company can send me a check for my premiums and say, we're just going to rescind coverage and pretend it never existed. So, I mean, rescissions, that's the only reason that they'll be able to rescind coverage is if you were fraudulent in the application process. Another thing that you're not going to allow to have, if you've got a group plan and you've got more than a 90-day waiting period for new employees, you can't have that on the first renewal on or after October 1st of this year. So, we've talked about grandfather status, why you might want it. We've talked about what you're going to have to comply with even if you do grandfather your plan. So what happens if you grandfather your plan or you qualify for grandfather? What do you do to lose that grandfather status? Well, if you change carriers. You know, I meet with my clients. These are all the things we're going to talk about are things that I routinely speak with my clients about every year when they face a premium increase. What do we do to try to contain the cost? One of them is changing carriers. We forfeit grandfather status. Another thing we do, sometimes we go from 90-10 coinsurance to 80-20, lose grandfather status. Increase the deductible. Very, very common. If you increase it more than 15% plus medical inflation from March 23rd, you lose grandfather status. You raise the copayment. More than 15% or $5 plus medical inflation. If you go from a $20 to a $30 copayment, you lose grandfather status. If you decrease employer contribution more than 5%. Now this is something that I have employers do. All of these things my clients do on a routine basis. So when we talk about grandfather plan status and you consider whether it's important for your business, you have to understand that even if you decide that it is important for you at this time, I do not believe many plans will be able to sustain grandfather status for very long. These are the kind of things you do to hold the cost down, and if you lose the ability to contain that cost at some point in time, you're almost certainly going to lose your grandfather status. Other parts of the Affordable Care Act we'll talk about is W-2 reporting for all employer-paid premiums Now this takes effect January 1st of 2011. And no, you don't do your W-2s for 2011 until the beginning of 2012, but you need to make sure that your software, you probably need to talk to my good friend Matthew back there, and make sure your software is going to facilitate tracking the premiums you pay, because you have to report on W-2s how much you pay for medical insurance for the employees, how much you pay for dental insurance, vision insurance. You got a health reimbursement arrangement where you help the employees with the deductible or co-insurance? You got to report that as on the W-2. Health savings accounts. A lot of my clients use health savings accounts. If the employer contributes to that health savings account, it's going to also be reported on that W-2. Now, I got an email last week from one of my customers talking about how starting January 1st, 2011, all of this stuff was going to count as income. And that's just not true. Very clear on that. I'm not saying it's good or bad. Now, it might at some point in time become taxable, but at this point, under the current legislation, it's not. Yes, Matthew? 3 minutes. All right. I'm almost done. The other thing that's important on the Affordable Care Act that a lot of you probably have not heard anything about, and I think it's very significant, is the Community Living Services and Support. That would be referred to as the CLASS Act. Kind of catchy, huh? It is a new government-managed long-term care program. The CLASS Act. Premiums are going to be collected through payroll deduction. Employers can opt out. Employees can opt out individually. Now, the key word here is opt out. That means that you're automatically going to be enrolled unless you opt out. The expected premium for this is going to be somewhere between $180 and $240. It can be as low as $5 for the young and working poor. Enrollment, again, is scheduled to begin January 1st of this next year.
Is that an expected annual premium or monthly?
Annual. Good question. The maximum benefit is expected to be $75 a day, which is woefully inadequate, quite frankly. And the 5-year vesting requirement requires that you pay premiums for 5 years before this plan will before you'll be eligible for this plan to pay benefits. And the one thing that I will draw your attention to with regard to the CLASS Act is this gives you good cause to seriously consider setting up a private insurance program on a voluntary basis for your employees, or maybe doing a management carve-out to provide the benefits, to replicate or replace the benefits that you would be considering paying for here, because long-term care is something that we all need to address. Mandates, I'm wrapping up. Mandates, there is an individual mandate, takes effect January 1st of 2014, and it requires that everyone maintain coverage. There are, of course, penalties if you are non-compliant, and those penalties will be 1 to 2.5% of earnings. They'll be capped at the bronze level premium, or it can be $325 to $695 as a fixed amount. Now, the employer mandate only applies to employers with 50 or more employees, or 50 FTEs. And I would assume they go by the same rules for counting those employees. But they also include controlled or affiliated service groups. I have a client that I'm working with who has a printing business and a direct mail business. They both work together. They're both owned by him. They would all count as one employer. The penalties for non-compliant is $2,000 per year per employee. But you do get to deduct the first 30 employees from that penalty. Those employers, so in other words, a 51 employee or a group would only have to pay the penalty on 21 employees. Those groups that are mandated and currently offering coverage must limit employee contribution to 9.5% of family income. Wish you luck figuring that out. Limit waiting periods to 90 days for new employees, and pay $3,000 per year if one of your employees finds it's a better deal to go get coverage with the premium subsidies on the exchange. So my recommendation to everybody is that over the next few years, you think about benefits that you provide to your employees as part of their overall compensation, and start shifting some of the raises that you're giving into benefits so that you will in fact be compliant rather than having to deal with us all at one time starting in 2014. Ladies and gentlemen, that's the end of my presentation. If any of you have agents that are not doing a good job, this is my little commercial. If any of you have agents that are not doing a good job, please leave your card, say consult. You've got questions specific to your circumstances, you can call me at 365-0017.